Good afternoon. If I'm a little out of breath, I literally ran here from my office. Sorry to be a few minutes late. All right, it is November still, Native American Heritage Month. Hopefully you're getting the emails highlighting individuals of Native American heritage and some of their accomplishments. COVID. All right, for COVID, we are in a surge. If you're not reading the news or paying attention to what's going on, the United States collectively is definitely in a surge. Every single day we're having records both in terms of the number of positive cases as well as the number of hospitalizations. California is late coming to the surge, but it does appear that we're seeing an increase both in our county as well as California. So we have over 52.5 million cases worldwide and almost 1.3 million deaths. In the United States, we now have over 10.5 million cases and very close to approaching 250,000 deaths. We're at 242,527. In terms of California, we're approaching 1 million cases, and we have over 18,000 deaths now. And of note, each week I've been reporting out on the positivity in California, and we're now up to 4.4%, which is a 30% increase from last week. And so this is the percentage of positive cases statewide over the last 7 days, and it's went up by a full percentage point just in the last 7 days. In Fresno County, we now have 33,287 cases, 456 deaths. And our hospitalization, and remember, this is something we watch very closely. We have 123 people hospitalized. So if you look at that upper left graph, you'll see that trend is starting to go up. And that includes both positive cases as well as ICU cases. And then only 11 ICU beds available. All right. And as far as the tier goes, we remain in the red tier this week because you have to be in a tier for at least 2 weeks to go up or down. And so it is anticipated, because of the high number of new cases that we're getting, that we will go back to the purple tier next week. So if our new COVID positive cases per day remain above 7, and right now it's at 8.3, then that will put us into the purple tier next week. What that means for our county is that we would go back to not being able to have indoor dining and that type of thing if indeed we go into the purple tier. So stay tuned for that. And really my message to all of you is the same message every week. I know we're tired. I know that it's hard to stay vigilant, especially with the holidays coming up. But that's the only way we're going to get out of this right now. The only other ways that we get out of it is either through new treatments for COVID, of which there's really none right now. I'll go over them next week, or vaccines. And we have had some positive information about vaccines, although there's lots of reasons not to get too hopeful right away. So I'm going to go over that with you. On this slide, the upper one is what I presented back in June to you about how many vaccines were undergoing trials. So at that point, there were over 125 vaccines that were not yet in human trials, and we had 7 in phase 1, 7 in phase 2, and 1 in phase 3, and none were approved. And now here we are, 5 months later, we have 38 in phase 1, 16 in phase 2, 12 in phase 3, 6 being limited use, and I'll talk about that in a minute, and then none approved. It will take a vaccine to get approved for there to be widespread distribution. And so I'm going to talk a little bit about the vaccines themselves. So there's several different types of vaccines. It's kind of interesting. They have different mechanisms for how they work. So one is a genetic, and this is vaccines that deliver one or more of the coronavirus's own genes into our cells to provoke an immune or antibody response. And the two manufacturers of that are Moderna and Pfizer, BioNTech, and Fosun Pharma have a collaborative, those three. Both of these vaccines require 2 doses, 28 days apart. So it's not like the flu vaccine. You have to get a dose and then 28 days later get another dose. And because they use RNA, a small little subset of our DNA, they require storage at extreme cold, so 70 to 90 degrees below 0 Celsius. And for these 2 particular vaccines, the U.S. has invested quite a bit of money, $2.5 billion for Moderna and $1.9 billion for Pfizer et al., to both manufacture. Remember the warp speed we talked about back in June? That was where the government has infused millions and billions of dollars of cash to a variety of vaccine manufacturers to investigate, do clinical trials, and eventually develop and distribute the vaccine if it becomes approved. So each of these vaccine makers, it's about 200 million doses of vaccine we would get out of these 2 providers if it's eventually approved. And this last week, the Pfizer vaccine is the one that showed 90% effectiveness. And it's generally felt, and a lot of flu vaccines are 50 to 60% effective. So that vaccine in particular seems very, very promising. Another type of vaccine is called a viral vector. And these are vaccines that contain some viruses that are engineered to carry coronavirus genes. And so what it does is it uses coronavirus itself to enter the cells, cause them to make a little bit of the virus to create an immune response. And so most of these are in either China or Russia. And both the Chinese and Russian vaccines that are viral vector are in limited use. So China is using that vaccine. It's being distributed to, I believe, their army, and same with Russia. And then in the United States, we have 2 providers, Johnson & Johnson and AstraZeneca with the University of Oxford. Both have vaccines they're developing that are viral vector as well. The Chinese vaccine as well as the Johnson & Johnson only requires 1 dose. And then the Russian and AstraZeneca require 2 doses, similar to the genetic vaccines. Again, the United States has invested quite a bit of money in Johnson & Johnson and the AstraZeneca to create doses of vaccine if they get approved. And then there's protein-based. This is where it contains the coronavirus protein, but no genetic material. And so there's Novavax and Medicago are the makers of those. And all of these that I'm mentioning are in phase 3 of the development. So they're in human trials, which is right before the approval. Both of these require 2 doses. Medicago, a Canadian company, actually uses a tobacco plant to make the vaccine, which is interesting. It's a Philip Morris company. And then we've invested about $1.6 billion in Novavax to support trials and again produce up to 100 million doses. So some of this money won't be given to the vaccine makers unless we actually get an approved vaccine. And it's also quite possible that eventually we'll have multiple types of vaccines out there simply because we need so many vaccine doses that it's unlikely that any one vaccine maker will be able to quickly produce enough doses. So we could have more than one vaccine maker. And then there's one more type of vaccine, which is an inactivated or attenuated. And this is vaccines created from a weakened coronavirus that have been killed with chemicals. And again, we have a couple of different of these that have been, are in use in the United Arab Emirates. And limited use in China as well. Most of these require 2 doses as well. And then finally, and these are not listed in the numbers of vaccines that I mentioned, is that we have repurposed vaccines. And these are vaccines that were used for other diseases. And the only one in phase 3 right now is one that was used for tuberculosis. and that is at the Murdoch Children's Research Institute in Australia. So that kind of covers all of the vaccines currently in phase 3, the type of vaccine they are, and the types of dosages. The vast majority need 2 dosages, so you can see where it starts to get complicated, either a vaccine that requires really, really deep cold storage, and also needing to give more than 1 dose are things that we're going to have to sort through when we distribute vaccines. So the things that are still to be determined in terms of a vaccine, one is who will get it first. This depends on which manufacturers are approved, the number of doses available, and the production capacity of that vaccine maker. And so depending on the number of dosages that they're able to provide and the timing, likely it would be first responders, essential or frontline workers and healthcare workers, and also individuals who are at high risk should they get the virus would likely be prioritized. But those are things being worked on right now. And then how will it be distributed? Governments at all levels are looking at this now, particularly with a likely changeover of our national leadership. This is a high priority. You may have heard President-elect Biden speak about this. The first task force he's put together is a coronavirus task force. And they're very much looking to how would you efficiently and effectively distribute a vaccine? And then how will it be administered? And so now you're getting down to the county level. How will a vaccine actually be administered in Fresno County? We are working on a plan in Fresno County through public health, and most of the plans are being modeled after flu vaccinations. So I saw right before I came down something in the news about pharmacies like Walgreens and CVS partnering with the federal government that they would be part of the vaccine administration process. So just like with the flu vaccine, and we're again encouraging everyone to get the flu vaccine, you can go to CVS or Walgreens or Rite Aid and get your flu vaccine right now, and that may also be the way that you could get a coronavirus vaccine in the future, quite likely. Could also be mobile clinics like we see with the flu vaccine, as well as maybe at your doctor's office. So all of the usual routes that you would get a flu vaccine would likely be the same routes that you would get a COVID vaccine once it's available. By all accounts, we likely will not have a vaccine approved for at least several weeks. I know there's a lot of hope that one would get approved before the holidays or before next calendar year. But even if it gets approved, it's going to take a little bit of time to ramp up production enough to get it widely distributed. And that's why it's really in all of our best interest if more than one vaccine manufacturer is successful. And so that's really where we're at with vaccines right now. With this current surge, our best hope is to not get COVID. But again, if we're going to put a stop to COVID, it just doesn't seem that we have the capability collectively as human beings to do the things we need to do to not spread COVID. And so our best hope is to get these vaccines up and running. So next week we'll talk about treatments for COVID. That's the only other strategy out there to get COVID under control, and that is to provide treatments. Similar to the vaccine, you'll see the numbers up here. Just FYI, far fewer treatments than vaccines in development, and only one FDA-approved treatment, remdesivir. But we'll talk about those in more detail next week. All right. Creek fire. So for the creek fire, I'm happy to show you this map on the right. You don't see any red on the map. With our weather last week, we seem to really put a damper, if you will, on the active fire. And so shortly, provided there's no additional flare-ups, we'll just be focusing on recovery from the creek fire. And to that end, really it's around those long-term supports. It will be months, if not years, that we'll be providing supports to individuals in our community impacted by the creek fire. Really working hard again to get FEMA access for all of them, as well as to provide emotional support. And then the Winter Readiness Task Force, there really were not significant incidents from last weekend's weather, but this is something that we'll have to closely monitor throughout the winter. to look for floods and mudslides and things like that. All right. A reminder with our pie distribution, we have a delivery date update. We had hoped to have pies available the Friday before Thanksgiving and the Monday, and now because of our bakery we're using, it's November 23rd and 24th, which is Monday and Tuesday. You will get an email describing when they'll be available and how to get them, and also if you need someone else to pick it up for you. And with that, we will see if we have any questions. It says, I saw a new employee screening icon on my computer desktop the other day. Should we still be using the DBH screening form, or is this new county-wide screening form that showed up on our desktop? Take your direction from our Human Resource Department. We actually were one of the first departments to develop a screening form, and so typically we've been pretty up to date with ours, and so we want you to be consistent with doing it, and so whatever our Human Resource Department says about the screening, that's the one you should be using. When we've had significant changes, either a new symptom or something else that needs to be tracked on the screening form, we've tried to modify our screening form just for consistency's sake. So that's what my recommendation would be for that. Any questions via text or email? We don't have quite as many people watching it, so if you're watching this not live and you think of a question that you want to ask, please feel free to email myself or Tina Young, my assistant, after the presentation, and let us know if you have a question that you weren't able to ask while you were on here. Yes, I did get confirmation that you should use our screening form, not the ISD screening form. Thank you, Helen Herrera, for letting me know that. All right, next week I'll be back. As I mentioned, I'll talk about some COVID treatments next week. Hoping, praying, crossing my fingers that our case rates don't go up significantly. But in the meantime, I do also want to let you know that we won't have an update the week of Thanksgiving, so you get a little break from me then. All right, have a great weekend, and I will see you next week.